name is Tyler, and I have excessive movement in my right shoulder which sometimes causes pain. When I raise my arm, I can feel it popping at the joint. Currently I have no pain. When I sleep on my arm, it will be achy and stiff when I wake up, and this lasts for about 10 minutes. Moving it makes it feel better. This pain is about 5 out of 10, and there's no numbness or tingling. Currently not on any medications and have no past injury or medical history.
Hi Tyler, my name is Amanda. I'm going to be your student massage therapist today. Today we're going to be going over some assessments. During the assessments, I want you to communicate with me at all times and let me know if you feel any pain or discomfort, and then we can modify or stop the test at any point. Do you have any questions?
Nope.
Do you have any concerns?
Nope.
Do I have your consent?
Yes.
First, we are going to assess the shoulder with palpations. We will be testing tension, texture, tenderness, and temperature.
So I'm looking for some tension, which I feel in the upper traps. Not so much in the supraspinatus. Infraspinatus has some tension as well. And some in the deltoid. Let me know if you feel any pain, okay?
It's a little tender there.
Okay, so we're going to note that the patient has some tenderness in pec region. So during the assessment, I also was looking for temperature variations and difference in texture, and I didn't notice any difference with the texture. There was no bogginess or no swelling, and the temperature seemed to be normal.
Then, we will rule out the upper and lower joints. We will start by assessing the active range of motion with overpressure of the cervical spine, followed by the elbow.
Okay, Tyler, I'm going to want you to tuck your chin to your chest. And I'm going to provide some overpressure. Let me know if there's any pain. Is there pain now?
Nope.
Okay. So that's a tissue stretch. Pain with that?
Nope.
Okay. I'm going to get you to move your left ear close to your shoulder. Any pain?
Nope.
Okay, I'm going to provide some overpressure. Pain?
Nope, just slight stretch.
Okay, and that was a tissue stretch and feel. And then the other side? Pain?
Nope.
Tissue stretch?
Yep.
No pain with that?
Nope.
Okay, and I want you to rotate to that side. Pain?
Nope.
Pain?
Nope.
Also a tissue stretch, and the other side? Pain?
Nope.
Pain?
No.
Also a tissue stretch, and we'll do extension, look up to the ceiling. Any pain?
No.
And then we will not do overpressure with that. Okay, Tyler, now we're going to assess your elbow joint and rule it out. If you could bring your palm to your shoulder. Any pain?
No.
Okay, provided some overpressure. Any pain?
No.
And I can feel that it's a soft tissue approximation. Now you can lower your hand to the table. Any pain?
No.
Okay, I'm going to provide some overpressure, and it is bone to bone and feel. And then Tyler, if you could spin your hands so that your palm faces your feet. Any pain?
No.
Okay, I'm going to provide some overpressure, and it's a tissue stretch and feel, and get you to face your palm towards your face. Perfect. Any pain?
No.
And that is also a tissue stretch.
We will now be assessing the shoulder joint for active range of motion with overpressure, as well as passive range of motion with overpressure, and resisted isometric movement in the open pack position. If there was any concern or pain in the posterior shoulder area, we would also assess the scapulothoracic joint.
Okay, Tyler, we're going to start with flexion of your shoulder joint. So I want you to face your palm inward, keep your arm as close to your body as possible, and bring it up like this. Is there any pain?
No.
Okay, so I'm going to provide some overpressure. That's about 160, 170, and then get about 180 with overpressure, and the end feel is a tissue stretch. I'm going to get you to keep your arm to your side and bring your elbow towards the wall. Is there any pain?
No.
Okay, so I'm going to provide some overpressure, which is about 50 degrees of extension with a tissue stretch as the end feel. Okay, now we're going to assess your external and internal rotation. So I'm going to have the arm abducted to 90. I'm going to ask Tyler to actively bring the back of his hand to the floor. Any pain there?
No.
I'm going to provide some overpressure. It's about 90. Any pain?
No.
Okay, and I want you to do it the other way, palm to the floor. Any pain?
No.
Okay, I'm going to provide some provide some overpressure. And it's about 45 to 50 degrees, and both end feels are tissue stretch. Now we're going to be assessing Tyler's abduction, and we've saved this range of motion to last because it does reproduce pain. So I'm going to have you palm facing forward, thumb up, and I want you to bring your arm up towards your head. Any pain?
Nope.
Okay.
But that's where it feels
so
like
there is some limited range of motion. It's about 150. And I'm going to provide a little bit of overpressure. And it pops out there. Was that painful?
Nope.
Okay. The end feel was bone on bone. So now we're going to assess resisted isometric movements, so rims of the shoulder joint. So I'm going to be testing the muscles in the area. So I'm going to put them into open pack position. Okay, and I'm going to apply pressure, and I want you to resist that and not let me move you, okay? You ready?
Yep.
Let me know if you feel any pain, and we can stop at any point. Okay, so don't let me push you down. Any pain?
No.
So I got to hold that for 5 seconds each time. Don't let me push you up. Any pain?
No.
Don't let me push you in. Any pain?
No.
Don't let me push you up. Any pain?
No.
Okay. Don't let me push your wrist down. Pain?
No.
And don't let me push your wrist up. Pain?
No, but I can feel it in the back of my shoulder.
Okay.
Hi Tyler, my name is Natalie. I'll be your student massage therapist today. So we'll be performing a series of special tests in order to assess your shoulder. So the purpose of this is to reproduce the pain in order to rule in or out any pathologies of your shoulder. So if any time you have any pain or discomfort, you let me know and we can stop or modify the treatment. Do you have any questions?
No.
Do you have any concerns?
No.
Do I have your consent to proceed?
Yes.
Wonderful.
Special tests. Load and shift test and Sulcus sign. The load and shift test tests for anterior and posterior instability of the glenohumeral joint, whereas the Sulcus sign tests for inferior instability of the glenohumeral joint.
So first I will start with anterior translation of the load and shift. So I will be stabilizing the shoulder and moving the head of the humerus forward. So a normal anterior translation would be 25%. He does go more than 25%, therefore it is positive. Do you have any pain there?
No.
Okay. Now I'm going to do posterior translation of the humeral head, stabilizing the shoulder. Any pain?
No.
Alright, so a normal translation would be 50%. In this case, his posterior translation is more than that, therefore it is also positive. I'll be moving on to the Sulcus sign, also stabilizing the shoulder. I'll be pulling it down on the humerus. Any pain?
No.
Alright, and I do see about 1 to 2 centimeters Sulcus sign, therefore he is a +2.
Yergason's. Test for the ability of the transverse humeral ligament to hold the biceps tendon in the bicipital groove during movement.
Alright, Tyler, so I'm just going to perform the test on you. So just keeping your elbow and your arm closest to your body with your arm flexed 90 degrees. I'm just going to find the bicipital groove with my thumb. So it's located here. I'm just going to keep my thumb there. So what I'm going to get you to do is externally rotate, so bring your arm out this way. At the same time as you're bringing your palm from facing down up to the ceiling. So you're going to be doing this movement, and I'm going to be resisting you, but we're going to be doing it in full range of motion.
Okay.
Alright? So I'm just resisting you, so do the movement. Wonderful. And it is a negative because I didn't feel the tendon or anything pop under my thumb.
AC shear. This tests for the shoulder joint, the acromioclavicular ligament, and if there is sprains present.
Alright, so I'm just going to be locating the spine of the scapula, and putting my palm on it, locating the clavicle, putting my other hand on it, and I'm just going to be squeezing, creating a shear force between the two. So you let me know if there's any pain.
Mhm.
I'm just going to be pushing them together.
No pain.
No pain? That indicates that it's negative test. Alright Tyler, so now we'll be moving on to dermatome sensation testing. So the goal of this is just to determine if you've lost any sensation. So what I'll be doing is running my finger along your skin. You let me know if you lose me at any point. Normally we do bilaterally, but for today we'll just do the affected arm. Okay, so if you just hold your arm out, I'll just be running my fingers down your arm. So anteriorly, help me the whole way.
Yep.
Posteriorly.
Good.
Good. Laterally.
Good.
And medially.
Good.
Perfect.
Myotomes. C4, shoulder elevation.
Alright, so I'm just going to get you to do a shoulder shrug, and I'll just be resisting you. Right? So I'll hold that for 5 seconds, and I'm just looking for fatigable weakness. There's no weakness there. So
C5, shoulder abduction.
So I'm just going to get you midway through the range, and I'm also going to be resisting you bringing your hand up to your head.
Okay.
So hold that for 5 seconds. And that was strong, no fatigable weakness, so also negative.
Reflexes. C6, biceps tendon. C7, triceps tendon.
Right, so first we'll start with the biceps tendon. So I'm just going to get you to relax your arm and have your palm facing up. You're just going to locate the biceps tendon here. Alright, so I'll just be hitting it with the hammer, not too hard. I'm just looking for a twitch response for the reflex. Alright, so we had a good response there, so that would be grade 2, which is normal. So next I'm going to do the triceps tendon. So just with your arm relaxed, I'm going to locate the tricep tendon here, looking for twitch. Alright, so there was a slight response there, so that was also grade 2, which is also normal.
Based on today's assessments, there was no pain with all shoulder range of motion with overpressure and no pain with rims. There was limited range of motion in shoulder abduction and popping at the end range. A positive sulcus sign and load and shift tests indicate laxity in the anterior, posterior, and inferior aspects of the glenohumeral joint. In regards to massage, it's not directly treatable. However, due to instability of the joint, muscle guarding and hypertonicity are evident. Though we do not want to completely eliminate muscle guarding, we want to address fascia restrictions and trigger points in surrounding structures. A strengthening RENET-MEX plan will provide muscle stability and forced closure of the joint, reducing any chance of injury. Joint lobes would be contraindicated due to the hypermobility in glenohumeral joint.